Greetings, friends and followers. This is Nurses Talking. I am Del Barzi. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students to retirees, anywhere in between. Today, I am very, very pleased to welcome Laura Alessio out of Puerto Rico. And I'm telling everyone you're a nurse, you're a health and wellness coach. You integrate holistic practices in your coaching, you say, emphasizing the importance of physical and mental well-being. Laura has a bachelor's degree in sociology and Spanish and a master's in nursing. And you served in the Peace Corps in Nicaragua, yes? As a community health educator. And she says that she is a dedicated yoga, a devoted yoga and meditation practitioner. And you're also a yoga coach.
I do have my certification to be a yoga teacher. I did go through a yoga teacher training. I don't really teach, but I can if
you so desire. Yes.
I'd rather practice and take classes than give and teach.
Okay, that works. But so you pursued other avenues before coming to nursing because you had a bachelor's in sociology and Spanish. What was it you wanted to do other than nursing?
Well, that's a great question. I remember when I was really young, I thought about being a pediatrician, and I always really loved working with kids. But I also, my mom was in a catastrophic car accident when she was 10 weeks pregnant with me, and we both survived. She suffered a traumatic brain injury. But I think growing up with a parent with a traumatic brain injury, I really learned to have a lot of patience with her. And so I think I subconsciously went into nursing after having that upbringing. So I know that the sociology in Spanish, I always loved studying Spanish and learning Spanish and using my Spanish.
Yeah.
But it wasn't till later that I, definitely decided I wanted to go into nursing. So I think like a lot of us, it's hard to know after high school exactly what you want to do or, at any time and kind of change our paths. But
yeah, absolutely, absolutely. So now, so you had someone in your life, close in your life, who had contact with the healthcare system. When you became a nurse, did it coincide with what you saw as the way your mother was as she interacted with the healthcare system?
great question. Yeah. So, luckily for me and my brother, she ended up having my brother 5 years later after me. So a lot of the treatments and the therapies that she received were when I was really, really young. So as I was growing up, there weren't necessarily, treatments and therapies that she was still doing. So she is, highly functioning adult. She lives independently now and has, on her own for a while. So it's like one of those people, if you've ever met someone with a traumatic brain injury, you may notice something or you may not. They on the outside they look totally fine. Obviously depending on the extent of the injury and the ultimate, result. But
Yeah. Excellent, excellent. It's heartwarming because very often you hear traumatic brain injury and your mind goes to the very worst scenario. So it's really heartwarming when someone is, had the injury and is doing very well post that. So that's great. So what kind of areas did you work?
So I actually did quite a bit of volunteer work in the hospital after I returned from the Peace Corps in Nicaragua. I really wanted to get exposure to as much as I can. So I volunteered in like the mother baby unit and the PACU and the ER. And then I ended up obtaining my emergency medical technician certificate. And so I worked as a tech in the ER, which really helped me. I'm a very visual learner. So having that exposure and seeing so much in the ER, I was doing that, before and during nursing school. And then during nursing school, I transitioned into a similar role at Children's Hospital, Rady Children's Hospital in San Diego. And then upon graduation, I became a public health nurse with the County of San Diego. So I worked in a variety of programs with low-income first-time parents, a program called Nurse Family Partnership, and then with the childhood lead poisoning prevention program. And then after that, I transitioned over to become a case manager. Specifically, I was doing workers' comp case management, so
Yeah.
helping injured workers get the treatment that they need, advocate for them. They're already under a lot of stress as it is, being injured at work, so helping facilitate that, to get them back to work. And then with that, I started to overlap with doing some case management in personal injury. So during the pandemic, we had a lot of downtime at home. So I'd always been interested in taking a legal nurse consulting course. My dad was a personal injury attorney and I never wanted to be an attorney, but I always found his cases interesting. And so I took the legal nurse consulting course during the pandemic, not with any, intention of really like starting a business or anything, but kind of just fell into my lap. I was talking with a colleague one day and she said that she could send me a referral and asked how she would pay me. And I was like, I'm not really sure. She said, start an LLC. She just made it sound so easy. So that was almost 3 years ago now. So I started my own legal nurse consulting business. So I was working mostly with personal injury attorneys on specifically, I was doing medical record reviews, but also like what they call defense medical exams. So where their plaintiff client is attending an exam that's demanded by the defense side. So doing that. And then I went to a med legal conference last summer around this time. And that's when I met a nurse coach and I had never heard about nurse coaching. And so I picked her brain as much as I can. And she's actually my nurse coach now in a professional sense. So I started a program in January of this year to become a health and wellness nurse coach. And I will graduate this coming August. And so now my business is transitioning into health and wellness nurse coaching because that's really my passion.
So you have had such a broad range of experiences. I mean, your experience spans so much in so many different areas. What then, having had all of these wide experiences and being in contact with healthcare, with nursing in so many different areas, what do you think you want to see change?
Another great question. So unfortunately, I feel like our healthcare system, is more of a sick care system. And that's why I'm really so passionate about nurse coaching, because I see so much potential that we as nurse coaches can do on the front end of healthcare, preventative, treatment and education and helping to work with clients proactively so that they don't end up in the hospital. So that's, what drew me really to the nurse coaching. It's something that I wish I knew about a long time ago, but the universe works in its own ways. And so I'm happy, better late than never. But I remember when I did do my yoga teacher training, I really loved learning about like the Ayurvedic medicine and then meditation. And at the end, I was trying to figure out a way that I could incorporate that into nursing, but I didn't really know where to start or how to get clients. And then I also personally was diagnosed with Hashimoto's autoimmune condition. And had I known about nurse coaches, I would have definitely been interested in working with one as I was navigating that journey to get back to health.
Yeah. Wow. So much. So, and the Peace Corps. What I am interested to know, you worked as a health and wellness coach in the Peace Corps, a health and wellness educator in the Peace
Health
Corps.
educator.
What did you learn from that?
I learned a lot of Spanish. That is really what helped me solidify my Spanish. But I learned a lot of, about different cultures and the way that different, cultures, the way people live in other countries. And that's one of the most beautiful things about the opportunity that I had. Peace Corps really emphasizes, like exchanging culture, like ideas and norms
Yeah.
and what we do in one culture, sharing our culture, being from the United
Yeah.
States and learning about their culture, their lives as Nicaraguans. And the last, goal of Peace Corps is implementing change. So being really aware that change is not going to happen overnight, and they may be resistant to change, and that's okay. Just having the utmost respect for their beliefs, because the last thing we want them to feel is that there's some American coming in and changing the way that they live.
Mm-hmm.
So really, proceeding with caution and being aware of how it's being received,
Yeah.
and
Yeah.
knowing that our impact can make a difference even if we may not feel like it is right at that moment or day.
Yeah. 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 So, what is your big vision for you in the next 5, 10 years? And I know you want to develop your coaching business and all of that, but what is your big vision for you?
So I just moved to Puerto Rico 2 months ago for we're here for my boyfriend's job as a boat captain, and I've just really loved the people that I've met, and I feel there's a lot of opportunity for education and working with clients here. And so I am working towards building my private practice and really just networking with the community here, in the medical field, trying to meet as many people in the health industry as possible to let them know that I am here, because I'm pretty much, I think, the only nurse coach on the island. But I also will be working remotely. So essentially, anywhere in the world. I am licensed as a nurse in California, and I'm working on my license here. And so, yeah, moving forward with my private practice and my business, and being able to help as many individuals as possible improve their health and wellness. And
Good, good, exactly, awesome. What do you say? Having had all of this experience, all of these wide experiences, you've been EMT and volunteer and public health nurse and workers' comp and all of this. What would you say to somebody who wants to be a nurse? What advice would you give them?
I would definitely encourage them to stay open-minded about all the possibilities that nursing has to offer, because I think that a lot of nursing schools really focus on bedside nursing and encourage their students to go to the bedside, which nothing wrong with that. But I have learned so much in the last few years about all the opportunities in nursing, and I'm sure there's still more that I don't even know about. So
Yeah.
just considering all that, there is out there to do.
Yeah, yeah, yeah. That nursing degree is really just an open door. Uh, all you have to do is walk through and walk any way you want to.
Exactly, exactly.
Yeah, yeah, yeah. What do you do to care for you, though? What does self-care mean to you, and what do you do to care for you?
Yeah, we've actually really spent a lot of time on that in the nurse coaching program. And I think especially, post-pandemic, our
Mhm.
society, we've seen a lot of mental health issues and challenges, and I really think that self-care is so important. And so for me specifically, as I mentioned before, I've been practicing yoga for almost 20 years now,
Mhm.
and yoga and meditation are one of the ways that I really find that I can care for myself the best. But I really think it's important that we look at the overall picture, like from a holistic perspective. So physical health is one thing, mental health, emotional health, spiritual health. There's so many different aspects of health, going as far as occupational health, financial health, really looking at all aspects of an individual's health
Yeah.
beyond just like are they sick or well, looking further than that, and really trying to, I mean, it's kind of a balancing act. Ideally we want to feel pretty healthy in all areas. Obviously easier said than done, but just keeping in mind, all the aspects of health and how we, feel in each of those areas.
Yeah, yeah. And you mentioned you emphasized a lot of different areas of health. Very often when people talk about health, and we talk about it holistically, and we get to the physical, the mental, the spiritual, and and the emotional maybe, and we kind of like stop there. You went ahead and you included things like the financial and all of that, and all of those other things that actually affect those same physical and mental and emotional health that we're talking about. So
Yeah, it's all connected.
awesome. It's all connected. It's all connected. Yes, it's all connected. So you've seen a lot of nurses in a lot of different areas now, then. If you could tell me in one word what you see as the most essential quality of a nurse, what would that word be?
First word that comes to mind is patience. And I
Patience.
think
Okay.
that's really something that is, a quality that's very important to have as a nurse, because we're working with people in, from every walk of life, in every situation, maybe in the worst day of their life. So
Yeah.
really having patience and empathy for them.
Yeah. Yeah. It's if you don't have it, you better develop it.
Practice.
You better learn it and develop it and work on it because you're gonna need it.
You don't have it, you'll learn. It'll grow on you. Start to learn to get it.
What do you see as what do you see in all that you have done? What do you see as the thing you're most proud of?
I think I'm most proud of starting my own business, because that was something that I, definitely didn't expect to happen. And I mean, I love that it did, and I'm so proud of that accomplishment, and that I, pursued and persisted, and now transitioning to, I don't feel this is necessarily like opening a new business with the nurse coaching, but it's, still under, kind of the same umbrella, but really feel like, now I've found what I'm really most passionate about. Like I've enjoyed the journey and the experiences in each area of nursing, but I'm really most proud of, having started my own business and
Mhm,
continuing on with that. Just
And on all of those experiences that you have had, and you bring them under the umbrella of coaching, and there's so many different experiences that you can draw on now, um, in order to help someone along.
definitely. I mean, I think with my coaching, I'll be able to take my, experiences that I've had and work with individuals. And I'm also starting a functional medicine course in September, because that's who I ended up working with when I was diagnosed with my Hashimoto's. I worked with a functional medicine doctor. And
Hmm.
so I'm really interested in learning more about that, just how that can be so helpful to so many
Yeah,
individuals who are struggling with autoimmune. And there have been, in our nurse coaching program, they encourage us to choose like a niche. Um, and that's something that I have struggled with, because I feel like it's very limiting. And I'd like to keep, my practice open to, I don't want to, deny someone
yeah,
who I feel like I may be able to help, because if they don't fit under that
yeah,
category. So I think that ultimately will become my niche, but I also feel like niches can change over time. So
yeah,
just because it may be my niche now, maybe, in a couple years, like you
yeah,
said, I mean, asked about my 5-year plan. I
yeah.
honestly haven't thought that far yet. So maybe my niche might be something different.
Here's the thing, you may start off with that in that niche, which seems to be pretty narrow. But very often what I see happens in things like that is that you pull in other things and that actually fit and that actually, come under that umbrella anyway. And that umbrella turns out to be not so very narrow after all.
Exactly. Yeah. I mean, all your experiences, you take them with you, and you may be able
Yeah,
to pull from them, you know, not even realizing that that may be something beneficial down the line, at a later date.
Yeah, exactly. Laura, I cannot thank you enough for this conversation. Thank you so, so very much. Before we go, is there any words you'd like to leave us with? Any words of wisdom?
Yeah, I think just, really would like to make, more awareness about nurse coaching, and for anyone who's listening, really be open-minded about the idea. The short version, of when people ask what is a nurse coach, because I get that question a lot because it is newer. The short answer is I say it's like a life coach with a nursing background. So that seems to help a lot of people, better explain it, but we don't coach just nurses. So I think that's where there's a lot of confusion. And so, yeah, I think, I'm just wanting to spread awareness about nurse coaching and, encouraging people to, consider it if they are wanting to improve their health and wellness. Because like I said, the healthcare system is really, broken, and we're dealing with more of a sick care system. So, especially post-pandemic, wanting to share that, nurse coaches are out there where they're going to be they're already working in hospitals. So, if you're, interested or curious, look into one, that may be nearby you, or, anywhere really, because they can work remotely.
Go for it. Laura, thank you so very, very much. I've truly enjoyed this. Thank you.
Thank you, Dale. I appreciate the opportunity. It's an honor to be here.
My pleasure.